Hi, I'm Shelly. I'm a Maryville nursing student, and I'm going to be doing my physical ear, nose, and throat examination on a 43-year-old male. We're ready to start. So first I'm going to do my inspection and my palpation, starting with his eyebrows and eyes. So when I look at his eyebrows, they're well defined, filled in, fully formed. His eyebrows extend all the way out to his temporal canthus. And when I palpate his eyelids, they are not swollen. There is no edema, no redness. There's no crusting of his eyelids or eyelashes. I'm going to palpate his lacrimal glands. They are not palpable at all. When he closes his eyes close all the way. I'm going to take my pen light here and look at his conjunctiva. I'm going to pull up down slightly here. Conjunctiva is nice and pink, both sides. His sclera is white and shiny. Good. I'm going to take my otoscope here and I'm going to look in your eyes, okay? So I'm going to hold it in my left hand to look at his left eye. All right. And whenever I look at his eyes, his red reflex is present. His pupils are round and reactive to light. And to test for accommodation, I'm going to have him to look at my finger, go all the way to your nose, and then look at the wall real quick. Good. And they quickly dilate. All right, so first I'm going to look in your eyes here. And what I'm looking for is I'm going to look for his optic disc. And I'm going to have my diameter set to 0. Hold it close and I'm going to come in. I can see the red reflex real easy. And I'm going to dial in as I come closer. Good. All right, I can see his optic disc. It's sharp. It is a yellowish color. So I'm going to have you look to the left and then to the right. Yeah, go ahead and look back to the center, to the light. I don't see any blood vessel hemorrhages. There are blood vessels that extend from the optic disc, the cup, and the macula is purple. The anterior chamber is deep and full and clear. So go ahead and open up again. Sorry, there we go. I don't see any hemorrhages, as I said. No foreign bodies are present. Good. All right, excellent. So sorry. All right, good. I'm going to go ahead and look in your, I'm going to start the rest of my examination, and I'm going to do a couple of motor tests for your eyes. And so there'll be, one of them is called the confrontation test. So the 6 cardinal gazes. And so what I'm going to have you to do is to follow my finger from the middle. So we're going to start with here, and we're going to go out to the center, or out to the left, to the right, to the center, this is to the left, to the center. Out, up, down, middle, and then back. There, up, down, middle, and then back. Okay, and then I'm going to have you to follow it just to the left and to the right. There, there, and then there. And there's no nystagmus. All your 6 fields of cardinal gaze are intact. There's no nystagmus. I'm going to have you to do a cover-uncover test. I'm going to have you to cover one eye, and then quickly uncover, and then cover the other eye. Good. And his eyes do not lag. There's no lagging or strabismus. I'm going to also do a corneal reflex test, in which I'm going to take a cotton swab and touch the outer edge of your eye. And so this may be a bit uncomfortable. Tell me if it is. And I'm just going to see if you blink whenever I touch your eye, okay? All right, good. All right, so corneal reflex is intact. Before we started the examination, we did a Snellen test with the Snellen chart, and with correction, he tested 20/40 with correction and 20/50 in his right eye. All right, so next, whenever I am going to look in his eyes, I see that his pupils, his pupil color is brown. His irides are brown. His pupils are 3 millimeters. They're equal, reactive to light, and they're centered symmetrically. I don't see any issues, like I said, with foreign bodies. Next, we're going to move over to your ears. I'm going to palpate your ears here, okay? First, I'm going to palpate your sinuses. Any problems here with pain in your frontal sinuses?
No.
All right. How about with your maxillary sinuses?
No.
Good. I'm going to feel your ears here. Your ears are symmetrically placed, nice and pink. I don't see any deformities, any swelling, any nodules. I'm going to look in your ears if that's okay.
Sure.
So what I'm going to look for is your tympanic membranes. So Sorry, I'm going to pull your ears up and back. Minimal cerumen. Tympanic membranes are pink pearly gray. There is a cone of light at 5 o'clock. Bony membranes are present. I see cilia. Excellent. Okay, and the ear canal is free of any foreign bodies or discharge. Good. All right. I'm going to look in your nose here. So when I palpate your nose here, nose is midline. There's no abnormalities, no swelling, no erythema. I'm going to have you look back for me. I'm going to look up in your nose. Good. Turbinates are clear. They're patent. I see nasal cilia present. No obstructions, no bruising, mucosa's pink. There's a mild amount of clear discharge. I'm going to have you to close off one side and sniff. Good, close off the other side and sniff. Good. All right, now we're going to look in your mouth. So I'm going to have you lean back and say, ah. Good. Tonsils are present, 2+. Oral palate, the soft palate and hard palate are present. They are pink, not swollen, no exudate, no erythema. Good. Your tongue is soft pink. There's no nodes, no swelling. Go ahead and pull down your gums for me. Good. No issues with the gums. There's no foreign bodies. It's not swollen, not erythemic. Go ahead and pull up your top gums for me. Good. Same way. Dentition is nice and good. Okay, I'm gonna feel your gums here. Any pressure or pain when I do this?
No.
Good. Okay, good. I'm gonna have you take your tongue and stick it to the corner. Good. Press. Excellent. I'm testing the strength of your tongue. Good. All right. Stick your tongue out for me. Good. Now I'll have you just stick it straight out. Good. Pull it back in. Good. All right. So, I'm going to test your gag reflex, and so I'm going to have you, when you stick your tongue out, this may be a bit uncomfortable, but it'll be over quick. So I'm going to stick your tongue back. There you go. All right, good. Use positive gag reflex. All right. Now, whenever I tested when I was pressing on your side of your mouth, that's your cranial reflex 7, and that was present. Your gingiva, your gums are nice and pink. The last thing I'm going to test is I'm going to check your lymph nodes, and so you're going to be palpating the back of your neck. So these are your occipital lymph nodes. They are not palpable. Your lymph nodes, post-auricular behind your ear, are not palpable. Pre-auricular are not palpable. Parotid are not palpable. Tonsillar, submandibular, submental, and behind your sternocleidomastoid and in front of your sternocleidomastoid. These are your cervical lymph nodes. That hurt at all?
No.
Good. And then above your clavicle, these are supraclavicular lymph nodes. Good. All right, any pain there?
No.
Okay. The last couple things we're going to do is a hearing test. And so, any trouble hearing me this entire time?
No.
Okay. So I'm going to have you to plug one ear, and I'm going to whisper a 2-syllable word. So I'm going to come on this side and tell me the 2-syllable word I say. Pitchfork.
Pitchfork?
Okay. I'm going to come on this side and do the same thing. Plug this ear.
Eyebrow.
Okay. Fabulous. All right, the last thing I'm going to do is I'm going to check your hearing conduction by sticking this tuning fork on top of your head. So you're going to tell me if you hear it in both ears, one ear, or neither.
Both.
Okay. I'm going to stick this behind your ear on the bone, and then I'm going to stick it in front of your ear, and I'm going to have you tell me when it stops ringing, okay?
Okay.
Tell me when you stop hearing it.
Okay.
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 Okay. So his air conduction is 2 times greater, at least 2 times greater than his bone conduction. Therefore, his hearing is excellent. All right, that concludes our exam. You did great. Thank you, sir.